Hello, everyone. Welcome. So excited that we get to meet one of our new doctors at Lifestyle Telemedicine. Thank you so much for joining us. All right, so the first thing is we want to see where are people watching from. So if you are watching us from YouTube or Facebook, we would love to hear where you are watching from. And while we're waiting for people to kind of message us about that, I would love to hear, well, just first of all, we've got someone from Colorado. That looks like our very own Dr. Scheuer. You're amazing. I love that you always are watching us on these. So from Colorado, not too far from me in Utah. And Dr. Olshausen, where are you located right now?
I am in Oregon, so, we're kind of in this little triangle, not too far away.
Yeah, great. And we've got Karen from Georgia watching right now. Thank you. All right, great. So keep letting us know where you're watching from, and we will post so we can see where everyone is watching from the world. And it's important that we say this because at Lifestyle Telemedicine, we have doctors who are licensed in all 50 states and DC and international. So no matter where you're watching from, you can also find one of the doctors that covers one of your states or wherever you happen to live in the world. So today's webinar is really meant to be a chance for you to get to know one of our new doctors. Just started with us a couple of weeks ago. And Dr. Philipp Olshausen, I am so thankful to have you as a colleague now. Just very excited for you to join our group. And we would love to get to know you a little bit more. So why don't you start out by telling us a little bit about your background? Where did you come from? And then ultimately would love to find out how you found out about lifestyle medicine and what got you excited about that.
Sounds great. Thank you so much for having me. I'm very excited. I know it's only been a few weeks, but the excitement has grown since I've joined the group. So yeah, my name is Philipp Olshausen. I am an internal medicine physician and lifestyle medicine physician by trade. And I'll just kind of start from the very beginning. Born and raised in Germany. And that's also where I went to medical school. And I've been a physician now for 23 years. That's when I graduated from medical school. Seems like a long time. And then moved to the United States. I was kind of preconditioned, I guess, because I lived in the States for a few years when I was a teenager. So I said, hey, let's go over there to do further training. And that's where I did my residency on the East Coast. And then soon thereafter went to the West Coast, where I have been ever since. So just about 17 years, as I mentioned earlier, in Oregon, which I love. So that's kind of my journey, briefly summarized. I've always practiced primary care as an internal medicine physician. That's really been my bread and butter in different practices, but really ever since training, always in Oregon. And it was only about 2.5 years ago that I discovered lifestyle medicine. It was one of those continuing medical education courses that you take, where I think it was called Food as Medicine. I said, that sounds interesting, and I need some credits. Well, after the about 5 hours of that course, I was just sold on everything lifestyle medicine. It was just so a breath of fresh air to really learn about food and what it means, more than what I ever thought or even knew or certainly learned about as a physician. You kind of think I know about it, but and I knew some of it, but there was probably about 30-40% that just blew my mind as far as the impact it can have about all these different conditions that I deal with day in, day out with patients. So that's how that started. And since then, that's really the passion that I've tried to grow, which is not always easy because you have to kind of figure out how can I implement it into a practice. Unfortunately, in traditional primary care, there's often not the time to really dive deep into different lifestyle areas, and it's so much more than just food. But I've now found some niches and areas where I can actually practice this. And of course, this group, Lifestyle Telemedicine, is one of those.
Wonderful. And so what got you into medicine to begin with? I mean, just in general.
Wow, now we're really going back. So
we're going deep here. We want people to really know you.
I mean, I think even in high school, I was kind of science geek. I did enjoy the sciences, so that set me at least on that rough path. And
Me
then,
too. I love science.
yeah, and then I think what happened was back in high school in Germany, we had this sort of um, the thing where you kind of pick a job and you worked in it for 2 weeks, kind of this experience program that everybody kind of had to do. And the only reason I chose a hospital was, I had an uncle who was a doctor and I couldn't really think of anything else. It was kind of a coincidence at the time, but even though I mostly worked in the nursing field at that time, the surgeons would take me into the OR and, I would just experience the whole setting of the hospital. And it was pretty much after that 2-week stint that I was sold on, yep, this is something I want to pursue. Obviously not yet sure in what, specialty, but definitely that medicine was probably the thing for me. And then really never looked back since.
Yeah. And I guess tell me a little bit about your experience of working in, more traditional care and, when you found lifestyle medicine,
Yeah.
uh, how did it change kind of your view of what you were doing in medicine?
Well, I think really the first probably 10 years or so of my career were pretty traditional primary care. Although I will say the first clinic that I worked for was an integrative medicine clinic. So while I was probably their most traditional physician as far as the care I provided, I was at least, exposed to some different things. I would not call it in any way lifestyle medicine, but at least some slightly alternative things. And then one really wonderful example that shaped my career was 6 to 7 years of a direct primary care practice. For anyone who doesn't know what that is, it's more of a cash pay model, a membership model, which has the advantage of kind of leaving insurance outside the door and just doctor and patient really having a relationship and kind of doing what is important to the doctor and the patient as a team rather than having that third party in. So that was eye-opening, liberating, and just fun. I did then switch to fully virtual practice, which is why I stopped that. Otherwise, I probably wouldn't have. But it was also that I think led to just being a little more aware, hey, if I actually have the time, 30, 45, 60 minutes with a patient to just really talk about stuff, not just what medications are you on, what's your blood pressure? Okay, moving on. But really get into their life, what they like, what they don't like, how they sleep, their mental health a little more in depth. It kind of opens your eyes a little bit. And so I think I was already preconditioned to maybe find something else. So that's when I think the food as medicine course that I mentioned really caught my interest. And then I think once you do that, I don't know who could do that and not sort of keep going and digging a little deeper in that direction. And that's kind of what I did. Yeah.
Yeah. Well, and I'm glad you brought that up because I think, of course, during residency, I was doing more traditional care where it was these 15-minute quick appointments, and there were certain things you had to get done in that short amount of time. And even someone who was already interested in health and nutrition and lifestyle medicine, I even found it very difficult to try to squeeze that in those short time frames. And unfortunately, it's hard to really get to know the person, right? When you're only seeing them for that short amount of time, it's hard to really understand what are those barriers to being able to make significant lifestyle changes. What is the home situation like? Who does the grocery shopping? Who does the cooking? And really, instead, because typically what happens is, if someone comes in and they have some maybe chronic lifestyle related diseases, the doctor might say to them, well, okay, so you need to improve your diet and you need to get out and exercise, but they're not really giving much more than that besides just, okay, it's time to go make some changes, right?
Exactly. Yeah, I
And
think
and
it's,
it's hard, yeah, it's hard
sorry,
to
go ahead.
squeeze that in.
Yeah, I think the time constraint is huge. I think there is, and I was the same, there was also a bit of a lack of knowledge for some of the areas. Um, I don't know about you, but I didn't learn that much about nutrition, and certainly in medical school or in residency. So, it was either what you discovered yourself or what you knew already. So there's
Yep.
that. And then definitely that lack of being able to personalize the approach as well. I mean, you could kind of tell everybody the same thing based on whether they are have high blood pressure or high cholesterol, you kind of just say your 1 or 2 lines because that's all you can do. But I really now enjoy asking people, not just telling people what I think is important, even though I try to give them information and educate them, but also say what's important to you. And sometimes you're surprised. I mean, oftentimes they'll have kind of aligned goals to what you probably would have told them anyway. But once in a while, they'll say a few things where you're like, oh, I would probably have not thought of that. Or, I appreciate that that's more important to you than maybe exercising at this time. And then we can revisit that later. So that part of not just, one size fits all has been a lot of fun to really explore that.
Well, and I think that that is so powerful, that what's important to you. I don't think a lot of patients hear that. I don't think a lot of patients get that question. And I think the reason that it's important is that it can really distill down to the why.
Right.
Especially the patients who come to us who are very motivated to make, for the most part, very motivated to make lifestyle changes for whatever reason. It really helps to clarify that purpose. Why are you wanting this? Of course, some people will come and say, I want to lose so many pounds, or I want my A1C to be better, but it can't just be the number, right? There's got to be something behind that. And so if you ask the why, we can really get down to more of like, well, I really want to be able to hike with my sister, and
Right.
I can't do that because I'm running out of breath, and she goes up these mountains that I can't do. I want to be able to do that. And so I think that that's really, it's great having that extra time. I mean, we see patients in 30 minutes or 60-minute visits where we can really talk about that and really get down to that, so that that can be the goal, right? And I have had patients where their goal isn't to, maybe they have weight that they want to lose, but their goal isn't to watch the scale. They don't want to be standing on the scale all the time and focusing on a number. They want to feel better. And they know that
Right.
by losing weight, they'll feel better. But that's their ultimate goal, is to feel better. And so if I know that, then I know, okay, we're not talking about your weight. We're not going to be talking about a goal number. We're going to be talking about, how are you feeling? How are you feeling
Mm-hmm.
this week? Are your clothes fitting looser? Are you getting out of bed easier? So we can really tailor to what you just mentioned. What is it that you really want? What are your goals?
Yeah, I think a lot of the numbers, whether it's weight or A1C or blood pressure, are probably mostly imposed already by us as physicians or another physician that they've talked to. So that's more the artificial thing. And when you don't have the time, you kind of have the chart before you go into the room, and you or have a virtual visit, and you kind of read the chart. And I would feel myself already going in with an agenda without having any idea what the person actually wants. So that's nice to not have to do that anymore or do that anymore. So yeah, I agree.
Yeah. And I think, I mean, obviously it's good for the patient, but it's also good for the provider to be a little bit more open, and that you're not so focused on, okay, I got to hit this, this, and this before I let this person go. But it is more, it's the patient's time, right? It should always be their time, and that it's spent the way that they want it to be spent. So it's really impressive. It's pretty, I think, incredible that just by extending time, it really does allow us to do a lot more.
And I agree with what you just said. I think it does make me as a physician happier. So if I have a visit like that and I, hang up and finish, I'm actually happy about the visit, which is not always the case when you have to rush through a 10 to 15-minute visit, and you're really just checking boxes to make somebody else happy, not you or the patient. So and then in turn, if you finish every visit and you're kind of happy and joyful about it, that translates into the next visit and the next and the next. So that's kind of what I've been experiencing, which is fun.
Yeah. Yeah. And I will say, I can remember back the long days that I had in clinic as a resident, and getting to the end of that day and having all these charts that I had to finish, and just being so tired and so worn out, and to where I can, and this is I'm being very truthful with this, that now I can have a very similar long day where it's the same amount of hours, but I'm seeing a lot fewer patients,
Mm-hmm.
and I'm getting that extra time with them, and it feels so less rushed, and it's so much more meaningful. and I get to see people getting better. And by the end of the day, I still might be tired and I might be exhausted from the day, but there is just this general sense of just joy
Hmm.
and gratefulness with what I got to do throughout that day, that it feels night and day different from what I used to do.
Yeah, we should almost tell, rather than going into lifestyle medicine for the patient's benefit, which of course is very important, we should tell doctors to go into lifestyle medicine for their own benefit. Haven't really looked at it that way yet.
Yeah, and I will say that there are lifestyle medicine trained physicians who are going into it because of that, because they
Yeah.
are burned out and because they aren't happy with the current model and the way that that looks. And it turns out that when you have a happy doctor, a happy physician or other practitioner who's really enjoys what they do, they can do their job better,
Oh yeah,
right?
for sure.
So, yeah. So, now you've only been with us a couple of weeks now. Have you had a chance to see any patients, and how has that gone?
I have had a chance to see patients, and it's kind of gone exactly, like what I just described. It's been a great experience on both sides based on what they let me know. And so I'm excited to see, obviously, initially, so far, I've only had initial visits. So now I'm excited to see them again and follow up and follow through and have that kind of experience. Because while the initial visit is always fun getting to know someone, I think the follow-ups are crucial to
Yeah.
then get that positive feedback for yourself to, hey, great, this worked for you, or help them, fix something that didn't work for them. Um, yeah, it's that whole journey is so valuable, and I really like that as well. And that's also why I've always been in primary care. I think I always liked the continuity. I think sometimes, as physicians, we maybe complain about it a little bit, but in the end, I could never just work in urgent care or just work in a specialty where it's more of a one-time fix and then that's it. I do enjoy the continuity and getting to know someone. So, yeah.
Yeah, and I mean, that is one of the lifestyle medicine pillars, that social connectedness. And that
Hmm.
doesn't have to just stop at neighbors or groups, friends. It can also be part of what you do every day. And having that connection with your patients, I think can be part of that. And I really enjoy that social connection. When I get to see a patient that I've had for a few years and maybe I haven't seen them for 6 months and it's like, oh, how are you doing? Tell me about, your son's graduation or whatever. There is a social part of it too that's
Hmm.
really good for both of us.
Absolutely. I've also found myself asking questions that I don't think I ever asked before since I've been more in the lifestyle medicine realm. Like, just wondering, do you feel like you have a purpose in life? I don't think I've ever asked that question until the last couple of years. And people sort of pause for a minute, like, what did he just ask me? And then I kind of explain, obviously, why I asked that. But it is such an important fact to know about. And, ever since I've learned a little bit more about like the blue zones, those areas where people live long, long years, and that really is one of the big things that always comes to light. They have a purpose, they have that community. And that might be sometimes much more impactful than the usual things we talk about, which is exercise and diet. Not that they're not, but it's amazing what these other deeper things actually matter, or how they matter. And
Yeah.
it's just seeing patients' faces when you ask them that question and how surprised they are, but then also how they open up and tell you about it is pretty cool.
Yeah, yeah. And it makes me think about how the system is currently set up in medicine where it is very disease focused, right?
Hmm.
So when you have someone come in, they're giving you some symptoms and maybe you get some labs done and you say, "Oh, okay. So I'm diagnosing you with type 2 diabetes and that's why that you haven't been feeling your best and your blood sugar's been high. I'm going to now treat this disease that I've diagnosed," right? So it's
Yeah.
very disease focused. Or whatever it is, you're going to go and get a surgery or you're going to be started on a medication. Where with lifestyle medicine, we are really focused on the basic pillars of health and we cover all of those. And part of that is asking those questions of how do you socialize? What are your relationships like?
Hmm.
Uh, you know, are you positive? Do you have joy in your life? Do you have that purpose in your life? These are things that you're not going to get asked just like you said, in a regular doctor's office. Not only because they don't have the training, they haven't gone through the lifestyle medicine certification, but it's just not something that we learn in medical school or residency, uh, because we are more on that, how do you diagnose certain things and what are the treatment options for those? So it's
Yeah,
really a breath of fresh air to really go down to the basics of what are those pillars of health that we really need to be focusing on. So I think that that's really unique.
yeah, for sure. And even just the explaining with a new diagnosis, well, why you have this or why you may have this, which patients barely even ask because they probably also feel rushed in the setting of a traditional doctor's office. So yeah, certainly.
Yeah. Yeah. Well, and also going into that a little bit more, when I've actually heard patients tell me that, their doctor will tell them, with certain diagnoses, it doesn't matter what you do. Like, so I was just talking with Naomi Green yesterday on a
Hmm.
live. She's a health coach, plant-based health coach. And when she was diagnosed with breast cancer, her oncologist actually said, she asked, what can I do? What can I do? Because I know what you're telling me I need to do, like the surgery or the radiation or the chemotherapy, but what can I personally do? Can I eat differently? And she said, no, it doesn't matter what you eat.
Right.
Um, right. And so there is that part of it too, is that in lifestyle medicine, I feel like we have the opportunity to give people their power back of saying, no, you can do something. And diabetes doesn't just happen. I mean, when we're talking about type 2 diabetes, it is very lifestyle related.
Yeah.
And so we do need to get down to the root cause of that. What is causing that type 2 diabetes and how can we reverse it? And by the way, type 2 diabetes is reversible. I've seen it many, 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 many times.
Flash, flash.
Yes.
But yeah, it's the some of the conditions like diabetes, heart disease, high blood pressure. I think in most people's minds, it's pretty a no-brainer that they might be lifestyle related. But I think there's the other things like cancers or even autoimmune conditions or skin conditions, or then more vague things that don't really have a diagnosis, like bowel issues that haven't really fit into any category. It's those things that this can also help. You just have to kind of look at what's going on. What are you doing? And if you do it differently, could it help that? I mean, I'll use my own example. I am fortunate enough to have always been healthy throughout my whole life. When I kind of learned more about lifestyle medicine, and then really slowly but gradually, and now really 100% went whole food, plant-based with my diet, there was no condition to fix or no condition to improve or reverse. But within a few months, I just felt different. Yes, I lost a few pounds, but my energy level was really good. So much so that I thought, well, wow, I didn't really know how tired I was until I felt this way. So it's not even just, the obvious lifestyle related conditions, which we absolutely can help with quite a lot. It's sometimes just, I feel so much better and I didn't have a diagnosis. I wasn't really sick by definition. So yeah, that's kind of fascinating. And that's something to keep in mind. And so some people may think out there, I have, let's say it's an autoimmune condition, or I'm currently dealing with a cancer diagnosis or treatment or the aftermath of treatment. Just remember that lifestyle medicine can help with all of that to some degree as well. So
Yeah. And I think it's really important to make the distinction that lifestyle medicine is, first of all, evidence-based, right? So we use all of the studies and the research that has been done to come up with what are the best ways to make sure that you can live a long, healthy life, just like the people in the blue zones, like you mentioned earlier.
mhm.
So it's evidence-based. And the other thing is that, we are all trained in conventional medicine, right? So we all have that as our background, and we still can help out with things that maybe lifestyle medicine can't really necessarily help. We can talk with people about some of these conditions that, like type 1 diabetes. It's not reversible, right? Can you decrease your insulin needs by getting rid of that insulin resistance that might be overlying it? Absolutely, right? But we're all trained as conventional doctors, so we can all help with all of that. Plus, but then we have this like lens of lifestyle medicine that goes over that, so that we always make sure that if lifestyle medicine is either, if lifestyle changes are something that are needed to get to the root cause of the issue, or can be something that we can try instead of medications to begin with, then we will always do that. But it's great because you kind of get both worlds, right? You get a regular primary doctor who's been trained in family or internal medicine, plus the lifestyle medicine part of it.
Yeah. And then at the same time, combining those, we then also have the knowledge to actually safely maybe stop somebody's medications or decrease their dosages, which is nice. But
Yeah.
it's the science-based, evidence-based approach of lifestyle medicine that really attracted me to it. There's a lot out there, a lot of information out there, and it's confusing, sometimes confusing to me, and certainly I'm sure confusing to non-medical folk. And so trying to bring it back to, okay, wait, let's look at what we actually know for sure based on the research is, I think, important. It's a safety thing too. And I enjoy helping people or guiding people through the social media jungle of fads and trends and fringe things. So
Yeah, yeah. And, and I think a lot of people can not quite understand what lifestyle medicine is, because there are a lot of other specialties that people would assume. Are you a naturopathic doctor? Are
mm,
you an alternative doctor? You mentioned integrative medicine earlier, functional
mhm.
medicine. There's all these different specialties that are kind of, I guess, more alternative. And the way I like to describe lifestyle medicine is it isn't about prescribing supplements or getting a bunch of lab testing. It really is about focusing on those basic pillars of health, which are a healthy whole food plant-based diet, getting physical activity, good stress management, getting restorative sleep, making sure that you have positive psychology and social connectedness, and then staying away from harmful substances.
Well,
Right. So
we
yeah, go
often
ahead.
say it's lifestyle medicine is anything but rocket science. It is really, when you hear about it, it's so simple. It's anybody that hears about it is like, oh yeah, yeah, I know I have to do those things or watch those things, but then why are 80-90% of people, certainly in this country, not doing it? And why are we, if it's not rocket science, not more or not better at teaching it or informing people about it? So it's this fascinating disconnect, which hopefully will slowly but gradually and surely change over time.
Yeah. Yeah.
It kind of has to.
It does. It has to.
Yeah.
I know we're going to be making sure that we can do whatever we can to help make that change. All right. Well, I wonder if we can open it up to a few questions, maybe. Do you mind?
Sure. Happy to.
Okay. So let us know if you guys have any questions. Go ahead and type them in the comments from wherever you're watching from. We do have one from Karen. She's asking, do we have any nutrition training? So yeah, go ahead.
So no, not specifically. I'm not a registered dietitian or have any certifications. However, I would say that having gone through the lifestyle medicine curriculum, I at the same time do have some nutrition training, but it's very specific to the lifestyle medicine curriculum. So it teaches a lot about the impact of different macronutrients and micronutrients, and certainly also about where you get the important vitamins and minerals in your diet. So I guess my first initial answer was wrong, because all I thought about was kind of certifications. So we have nutrition training, but it's just not in that classic realm of registered dietitian or medical nutritionist. It's in the realm of the lifestyle medicine curriculum.
Yep, exactly. And because of course you and I both did not really get much nutrition training in medical school or residency,
Right.
I had to seek out some additional training. So in addition to doing the lifestyle medicine, I also did the eCornell course for plant-based nutrition certificate, did the starch solution because I worked with Dr. McDougall, and so did his certification program. So we do have to go out and seek some of that training for ourselves. And that's something that we're always working on, right? We're always learning more and more and more. And that's where having this group of doctors that are really, we are really focused and excited about learning whatever we can about lifestyle medicine and nutrition, that we're always looking at what are the new studies coming out, what are new things that we can learn. I know Dr. Greger just came out with some new information on things that have come out in the studies that have been done on what can lower LDL, in addition to just whole food plant-based diet. So, it's exciting. It's exciting to be part of that, and we're always trying to learn more. Okay, we have it looks like a comment here. Let's see. The word medicine has a stigma because our healthcare system is not healthcare. It's disease diagnosis and management. That's where the big bucks are, right? That's kind of what we talked about.
Agreed.
Yep. Okay, and then another question from Karen. Do you have experience with digestive disorders? Do you want to answer that one?
As a matter of fact, if you'd ever asked me, hey, is there any specialty that you might have seen yourself go into? I think GI or gastroenterology would have probably been the one. I just didn't want to do colonoscopies and upper endoscopies all day long, so I think that's what kept me away. So I have experience because I feel like I've always sought out, or I really worked very diligently with patients that did have some digestive disorders, whether it's actual, diagnoses that have been made, whether that's inflammatory bowel disease or things like that, or whether it's, which is often the case with digestive disorders, more of a vague, what we call functional disorders. Yes, you have symptoms of bloating or diarrhea or this or that, but all of the tests are normal. Now what? So I've dealt with a lot or a huge number of patients in that regard and have seen some success in just, again, looking at what are you eating, how are you eating, but also all the other things. How is your sleep? And sometimes going a little further with testing that may not be the norm or the standard, whether it's looking at food sensitivities or things like that. So yeah, I actually really enjoy digestive disorders, hard word. So yeah.
Yeah, I'm right there with you. And in fact, if we think about what do we get a lot in the primary care office, constipation,
Sure.
Diarrhea, bloating, stomach aches. So very, very common. And what also is common is that people aren't getting enough fiber in their diets, and people aren't getting enough whole plant foods in their diets. So a lot of digestive issues can just simply come from what your lifestyle looks like, what your diet looks like. And then of course there are going to be other things on top of that we're all trained as primary doctors, so we are very familiar with helping to diagnose digestive disorders as well. So if we hear certain symptoms or things that are going on, or we get certain lab tests, we can help with diagnosing autoimmune digestive disorders. So absolutely, we have this lifestyle medicine lens, but we're also able to help out with any of those things as well, just as a primary doctor would. Okay, we have another question here. So this is someone from California. Are you able to look for cancer markers many years before it shows up?
Well, so I guess the short answer again is yes, because there's tests out there that theoretically can be done. So I think this goes under the topic of kind of what's new but not yet standard of care. Is it fringe? Is it science-based? Does it have a lot of research? And one of the things that, sorry, I couldn't see the name, but a person from California that you might be referring to are these kind of multi-cancer early detection tests. So there is, I know of one blood test that's out there by a company that, screens for kind of 50 cancers by looking for certain signals in the blood that are secreted or set free by cancer cells. It's an interesting test. I've looked at it quite a bit. It's there's a lot of outcome data, meaning good research, hopefully, going to come out next year in 2026 on it to see, is it actually working and reducing, death from these cancers, et cetera, et cetera. So it's a test, I think, that is available. It's expensive. It needs to be paid for out of pocket. And it has some pros and cons for sure. I think you have to be very aware when you do tests like this that you might get information that's not that's going to lead you down a path of more testing that may or may not be cancer in the end. Of course, it also has the ability to find stage 1, stage 2, which would be early cancers early on, and could really impact treatment, impact your outcome, impact your life. So I guess to answer the question is yes, those tests are out there. I think my job, or the way I see my job, is again to educate you, kind of like I just did here in 1 or 2 minutes, about the pros and cons of these tests. Similarly, there's whole body MRI scanning is a big thing that people like to do and pay for. Again, pros and cons. There'll be things found if you scan anybody's body from top to bottom. There'll be things found that are probably meaningless or are not cancer, but they will still worry you and create anxiety. So again, I think it's important to educate yourself by certainly talking to one of us, but also understanding how this may impact the next steps. Anytime we order a test, we always like to know, why am I ordering this test? What am I going to do with the result, whether negative or positive? And sometimes that question is not 100% clear yet with these newer tests, but they are out there. So.
Yeah, I couldn't have said it better myself. I love having those conversations with people, and even things that seem very, like everyone should just get a mammogram, right? But some people have those questions. Well, what are the benefits and what are the risks? And I think it's important as doctors that we can talk through that with our patients so that they have the full information and can make that decision for themselves, instead of just saying, you need this, go get it done. I think it's really great to be able to have those conversations, and especially with some of these newer tests that are coming out, like those kind of cancer screening tests, really being clear with, if you are going to get this test, do you really want to go down that path of if they have a false positive or a false negative, right?
Yep.
There are all sorts of things that you got to think about there. Okay, we have this question. This is an interesting, well, I think this is more of a statement, but whatever will we do if RFK promotes eating more meat, dairy, and saturated fats? It's coming because behind Trump are the powerful industries feeling threatened by the plant-based food movement. Yeah, this is again going into all of that misinformation out there, right? Again, Dr. Olshausen and myself, we really focus on evidence-based medicine, and there is no evidence to support adding saturated fat to the diet. In fact, there's a lot of evidence against that. And
the opposite.
Yeah, the opposite. So what will we do? Well, we're going to keep doing what we are doing, which is shouting it loud and clear out there, the truth and what we know can help improve people's lives. And we are going to continue to help our patients live better lives by using the evidence. And all of that evidence points to living a really healthy lifestyle, using plant-based diet and a lot of the other things that we talked about, like restorative sleep and positive connections.
Yeah, listen to the science, and it can be confusing to know what the science actually says, because if bigger bodies that you thought were talking about the science also then, not necessarily listen to the science, it gets confusing. It's one thing if just a person on Instagram tells you something, you can kind of understand that may not be science-based, but if the bigger institutions also tell you certain things, then it becomes really confusing. So yeah, I think we are very, very devoted to really looking at the science very closely, and we'll continue to do so.
Yep. All right, and then we've got Robert. He says he didn't see a lot of the lecture, but he's a primary doctor. He follows a whole food plant-based diet. He's trying to get his patients to do it. He's wondering what we think about using algae-based omega-3 supplements. Do you have any thoughts on that?
Well, I guess my first answer is that I'm taking them. So I think omega-3 is kind of interesting ever since I've started lifestyle medicine, I've looked into this a lot because, there's obviously the statement that yes, you can get omega-3s through a plant-based diet, and that's true. But then you look a little further and you're like, okay, which omega-3s? And we're going to get probably very scientific now, but the really, really super duper important ones for your health, the EPA and DHA, are unfortunately not in plant-based foods, or very little. There's another one in plant-based foods that's ALA that gets, our bodies can make it into the other two good ones or excellent ones, but not at a great rate. So there is always the question of, am I taking in enough? If I'm purely plant-based, am I taking in enough of the plants with the omega-3s, that it's enough to convert to EPA and DHA, the really, really healthy omega-3s? And I think what I've kind of been doing is, first of all, talking about the issue with people, and then also suggesting testing. You can check your omega-3s, you can check your levels, your indices between omega-3 and omega-6s. And once you know that, and you know kind of how or what the patient's eating, you can certainly talk to them, oh, maybe you're just really not eating enough of any omega-3, whether plant-based or not. Or, you're really doing a good job, but it just doesn't seem to be enough. And that's what I found for myself. And that's when I started taking an algae-based omega-3 supplement, because I thought that was important enough to do that. And I think, not to digress, but there are a few supplements that are at least worth talking about when you're fully plant-based, depending, again, on how varied your diet is, because just with any diet, you can be doing a really good job and eating it or doing it as well as possible. And you could also not be eating as healthy as possible if you're not having that variety in there. So I think talking about B12 supplements and, again, checking levels to see where you're at, and possibly some other minerals, is reasonable to do. So I think it's a good idea to use. I mean, you could do it without testing. I think that would be safe. I don't know about anything saying that, you shouldn't get too much omega-3s. So yeah, don't know what you think about it, Nikki, but.
Yeah, definitely. I mean, that's, omegas are something that I do check pretty frequently in my patients, and working with people to try to get it through diet if possible. But there are going to be circumstances in which, even if they're doing a couple of tablespoons of ground flax every day, they're just still not getting enough. And so there are definitely situations in which people might need to supplement with, and of course the algae based, like Robert had mentioned, and that's of course what we would recommend instead of a fish based. And then being careful how you store those, because they can go rancid. Making sure that it's a reputable company. I mean, the FDA is not looking at supplements, so making sure that they're third tested, and just doing some of that research. And we can help with that, right? So, if you're interested in looking at some of these levels of B12 or omega, that's a great opportunity for you to meet with a lifestyle medicine doctor, get those labs tested, and then decide what supplements make sense if you need any.
Robert, by the way, kudos to trying to get your patients to do a whole food plant-based diet. Yay.
Yep. Yeah, I love it. Okay, we've got a lot of questions here. People are interested to hear from us. I love it. This one is from Sunny. I have a 19-year-old son who's eating a whole food plant-based diet. Lately, his peers are pressuring him to have eggs for more protein, and then he needs to get over 100 grams of protein to build muscle. What do you think? I'm guessing what the end of that is.
One of my favorite topics is protein, right after carbs, or maybe the other way around. I'm not sure. I have two teenage sons, so this is also, conversation around our house. I guess there's a few answers to this question. I don't know that the exact number of 100 grams of protein is what I would say he needs to build muscle, because I don't know what he weighs, etc. So, your protein intake that is recommended is based on your weight, so that different people need different amounts. And we can get to what the recommended amount is, because that's always a big controversy. But I will also just throw in here that he can get protein, not just protein, but actually quite a lot of protein, even if he stays plant-based, if he wants to do that fully. Again, it's just about the knowledge of, well, where is the plant-based protein, which foods have it, whole grains, legumes, beans, or just a quick list of a few, and then making sure to incorporate them on a regular enough basis that he does get to the number he needs to get to, which we can talk about in a second. So I guess one little myth is that you have to eat animal-based protein or animal-based foods to get enough protein. I don't know if he's watched the movie. Why am I blanking on the name? Help me.
Game Changers.
Yes, thank you. Game Changers, which would be a great movie to watch with his peers, to look at, hey, you can actually get the protein that you want, and you don't necessarily have to eat animal-based products if you don't want. So that's kind of number one. The other one that's a little trickier to answer, because you do hear a lot of different things, even from doctors or experts or things like that, is how much protein. There's definitely the official dietary guidance of 0.8 grams per kilogram, which, you can go and calculate that for yourself or for your 19-year-old son, which I think is certainly a good maintenance amount for pretty much all of us. If you do want to build muscle, or you are very athletic, or you want to stay very athletic, I think it's reasonable, or at least this is what I've been telling people, to go to that 1 or maybe even 1.2 gram per kilogram. There's a lot of stuff out there that says to do, 1 to 1.5 grams of protein per pound of weight, body weight, which is, of course, then double or more of that, which I have just not quite seen the evidence for, or the science for. I will also remark that if you ask, 100 physicians right now in the country of when they last saw their protein deficient patient, they will not remember, because that's not really a problem we have in the United States. So, all right, I'll be quiet now. I could go on.
No, I think that's really, I mean, that's exactly what I tell people too. I think it's the World Health Organization that says maybe 0.66 grams per kilogram of ideal body weight, and then the CDC that says 0.8. So yeah, and remembering that that's per kilogram of ideal body weight. So if you do have extra weight, you have to remember that it's based on your ideal body weight as well. And it is very easy to get enough protein on a plant-based diet, because you got to remember that all living things have protein. So when all living things have protein, that means all plants have protein. So every single plant that you eat is going to have protein in it, just at differing levels, right? So obviously legumes, beans, peas, lentils are going to have more protein than kale does, but they all still have protein. And if you're being told, oh, you got to have eggs to get that protein, you got to remember, where did that protein come from? It came from the amino acids that were in the plants that the chicken ate, right? So it's just that those amino acids are now put together as a protein in the eggs that you're eating. So yeah, go ahead.
No, so one of my favorite things to go back to that movie, Game Changers, was that, there's always this, I want to be as strong as an ox and, get all that muscle. And so I have to eat meat. And then they immediately pointed out, kind of like you just did with the chickens, what does the ox eat? Who is strong as an ox? He does not eat meat. So it's just kind of a cool way to visualize that.
Right. I mean, you think about gorillas and you think about elephants that for the most part are eating plant foods, and they can just become giant. Yeah. So you can get protein with plants, no problem. And you can work with one of us to figure out specifically for you or your child how much they should be getting, and what are the best sources for that. We're happy to help with those kinds of things. Okay, I think we've got time for a couple more questions here.
Sure.
So we've got this one that is, are you able to prescribe invasive tests for cardiovascular screening? Right now it's too late before they are prescribed.
I guess the question is, I don't know, invasive tests, to me, that would be something like a catheterization where, somebody puts a catheter in your groin or your arm to then visualize the arteries of your heart. I'm not sure maybe if you mean advanced cardiac testing, which is not necessarily standard of care yet, like a coronary artery calcium score, which is a certain form of a CT scan of your heart, but very low dose radiation. Or there are also now such things that are almost like a catheterization of your heart. I think it's the Clearly scan that
Yeah.
does a CT that gives an extreme detail of your coronary arteries just through a CT scan. So those tests, those actually non-invasive tests, but very, very good tests, I would say, for putting somebody or figuring out somebody's cardiovascular risk, depending on where they're at, are something that we can order. They're sometimes, yeah, I think the coronary artery calcium scoring is starting to be more insurance covered.
Oh, really?
Yeah,
I haven't had much success with that yet.
I think you have to. So I had one, so that's why I know, because my insurance paid for it. but
Oh, hey,
um,
there you go.
but I think I was being really clever with my diagnosis codes, and so that's. But again, that's something where maybe a physician can be of assistance to kind of. But there are those tests, and I think again, it's always worth a discussion, like we mentioned earlier, with why to order a test. What are you going to do with the results?
Yeah.
To have that discussion with your physician, with one of us, and then decide on, I think that's something you want to move forward with. And then, we can absolutely order that or facilitate that. And then, of course, also help interpret that.
Yeah. Yeah. So I would say, to be clear, we would not be ordering invasive tests like catheterizations, but we could order more advanced cardiovascular screening tests, such as the CAC score or, carotid ultrasound, things like that. So absolutely, we can help out with that. And there are also additional cardiac markers that you might not have tested before, with your primary doctor or even your cardiologist. A lot of times we're just looking at a lipid panel, but there are a lot of markers out there that can help give you a better overall view of what your cardiovascular risk is, actually
Yeah.
including the omega fat levels, right? So
Yeah.
we know that people who have normal omega fat levels have a lower risk of cardiovascular disease. So, all right, it looks like we've got one more question before we wrap up here. Thank you to
Sounds good.
everybody who's been watching and asking questions. This has been amazing, and it's
Yeah, it's fun.
a great way to welcome you to our group. Okay, this looks like Dawn, maybe. Any ideas on ways to get more restorative time that is tracked on my Aura ring? I'm often in engaged, but not often in restored. I'm not super familiar with the Aura ring and what engaged versus restored means. Do you know?
I don't. I was close to buying one, but then just thought it was too expensive. But yeah, so I don't know the exact wording or terminology that they use. I'm guessing most wearables that I'm familiar with, or even that I use, end up giving you sort of a sleep score, and they break it down into the important sleep stages of deep sleep and light sleep and REM sleep, or rapid eye movement sleep, and also tell you when you're just awake, which is not great. And then throw in things like your oxygen level, etc. So I wonder if the Ring or their app kind of comes up with, depending on how much time you spent in each of these sleep stages, your sleep was more restorative versus, I'm not sure, again, not sure what engaged is. So if your question is how to get more restorative sleep, that's a long answer. but again, good reason to, make an appointment with one of us. But some tidbits are, certainly look into, if you haven't already, sleep hygiene, which has nothing to do with having a bath before bed, although you can do that. It's really about behaviors, right, that we all have or don't have when it comes to bedtime. It's also things like sleeping in a dark room, in a cool room. It's also going to bed about the same time every night and getting up about the same time every morning, at least within 30 to 60 minutes, which, even on the weekend, which people sometimes cringe at, but all these things add up to make for better sleep. Now, that's not to be said that if your life is crazy and there's stress going on, or there's things happening that worry you, that's not going to have an impact no matter how hard you try to have good sleep hygiene. But those are some basics to start with. And then I've also seen people that use CBTI, which is cognitive behavioral therapy, but specifically for sleep issues or insomnia. I've seen them have some good success, which again, it just kind of goes into every behavior that you have surrounding sleep, which may include some not so good behaviors, and how to be aware of them and how to fix them or improve them or things like that. So that would be a very, short answer for now.
Yeah. Yeah. But, we have a lot of these tips and things. We've been trained in how to help people improve their sleep. And unfortunately, a lot of people struggle with getting enough sleep, getting restorative sleep. So that's something that we talk with our patients about a lot. So definitely a good reason to come in and see us to get help with that. We did have one question about just kind of how much does it cost to see one of our doctors. So a 60-minute appointment is right now $350 and a 30-minute appointment is $175. And then to get lab orders, in addition to that, sometimes they will be covered through insurance. So it kind of depends on how those end up getting ordered. And then you can also do one of our assessment packages. So we have assessments where it includes a 60-minute initial appointment, a set of labs, depending on what you're looking for, and then a 30-minute follow-up. And I believe that those are $695 on the website.
And I will say that we also have really good deals if you do want to get the labs, pay out of pocket, because with some of the nationwide lab providers, we have some really discounted rates, which always amazes me how low cost the blood work can actually be compared to if you actually try to get it through insurance, but then you have to pay your deductible, for example.
Yeah.
Thank you,
Yes,
Kim.
that's a really good point because, yeah, not everyone has insurance. And so if you're self-pay, like what you had mentioned, we have these discounted rates that actually make it pretty affordable, and we don't upcharge, right? We're just charging you what it costs us to send this lab order. So you can get a decent lab set for pretty inexpensive.
Yep.
All right. Thank you, everyone. It looks like we've got some people who've been watching, and it's been so nice to get to know you a little bit more, Dr. Olshausen. We're just so glad to have you on. And we haven't mentioned this, but you are licensed in almost all 50 states. So chances are, if you are watching us today and really vibe with Dr. Olshausen, he might be licensed in your state. You might be able to see him.
Yeah,
So,
pretty good chance.
Yeah. All right.
Thank you.
Thanks again, everyone, for joining us today. If you have not had the pleasure of working with one of our doctors, maybe now's the time. You just need a supportive doctor, somebody who lives the lifestyle that you are either living yourself or hope to live. Maybe you're on a bunch of medications and you're not sure what to do. You want to get off of them if you can. We would love to help you with that. Love to help you with whatever goals that you have. Please come and visit us at lifestyletelemedicine.com. And of course, you can always call us. Susan is wonderful. If any of you are our patients watching, you've probably talked to Susan on the phone, and she's always happy to talk with you. So you can give us a call, 888-420-7284. Again, we've got amazing doctors who cover all 50 states, DC, and international. So wherever you are, you can visit with one of us. All right. Thanks again, Dr. Olshausen.
Thank you so much. Looking forward to seeing you all in consultation.
Perfect. Thank you. All right. Thanks, everyone. Again,
Bye.
Dr. Nate Davis with Lifestyle Telemedicine. Bye.